If you're struggling with persistent hip pain, it's very likely that you may have tried doing clamshells. Clamshells are one of the most common rehab exercises for hip pain, but they may not be the solution that you need. Hi, I'm Dr. Dave Candy, an orthopedic manual physical therapist with over 16 years of experience. Early in my career, clamshells were one of my go-to exercises, but now I rarely prescribe them. In this video, I'll share 4 reasons why clamshells might not be working, how to do them properly if you are going to do them, plus 3 exercises that are even better than clamshells for relieving back pain, hip pain, and knee pain. So stick around because the solutions in this video just may be the thing you need to get rid of your hip pain. Let's get started. So first we're going to describe 4 reasons why clamshells might not be the solution that you need. But before I do that, it helps to understand what clamshells are supposed to do in the first place. Clamshells are supposed to strengthen your glute muscles, and particularly the glute muscles that abduct your hip and externally rotate your hip. And most people who have hip pain, whether that's from arthritis, bursitis, or tendonitis, do have some weakness of their hip abductors and external rotators. So doing clamshells makes sense in theory, but in practice it doesn't always work out that way. And here are the reasons why. Number 1, it's a low-level exercise. It's good for getting your brain to connect with your glute muscles, just to find them and learn how to turn them on. But they're very low force, and the force that you use just by lifting your leg, or maybe by doing that against the resistance of a resistance band, pales in comparison to what you need to balance your body weight over top of your leg when you're walking, going upstairs, and definitely running or jumping. Now, the second reason clamshells might not work is because they're not functional. Even if you could get your hip to produce enough force doing clamshells, you're doing clamshells lying down. But that's not the position that we function in from day to day. And just doing a movement like that, lying down, doesn't necessarily translate into using the muscles correctly when you're walking or doing other standing activities. Now, the third reason clamshells may not work is because you have to lie down to do them, which means at most you're probably going to do them once or twice a day. But that's not nearly enough to outweigh the things you do the other 16 waking hours during the day. So if you have exercises that you can do more often, you're likely to get a better effect from them. And the fourth reason why clamshells don't often work is because most people do them wrong. And I don't mean most like 51%. I mean most like 95+% of people do clamshells wrong. And if you're going to do the exercise, you may as well do them right so you get the benefit out of them. Now, clamshells aren't necessarily a bad exercise. They are good for early level rehab or just learning to turn the muscles on. But if you are going to do them, make sure to do them right. And here's how you do that. So to do a clamshell properly, you just want to lie on your side and slightly lift your leg so that you're activating your gluteal muscles. Now, here's the common mistake that many people make. They allow themselves to roll backwards like this, getting their back muscles into the movement. And also when they roll back, you can activate your tensor fasciae lata, another hip abductor muscle. What that means is you're using the muscles in your back and hip that are already strong to compensate for the muscles that are weak that you're trying to strengthen. And so even though you're going through the motions of the clamshell, you're not getting the benefit of the clamshell, which is strengthening your gluteus medius and gluteus minimus and deep hip external rotators. So you might have to roll forwards just a little bit more than you're typically used to doing. And if you don't think you're far enough over, roll over just a little bit farther. Now put your hand up on your hip. It helps if you take your thumb and put it right on the bump on the front of your hip and then your fingers and put them back on your glutes. This way, when you lift your leg, you can feel with your thumb that you're not rolling backwards. And you can also feel with your fingers that the glute muscles are turning on or contracting. Now you'll notice when you cheat or allow yourself to roll back, you can lift your leg a whole lot higher. If you do strict form and stay rolled forward, don't allow yourself to compensate with your back or your hip, then just lifting up like that, the motion is much smaller. But less is more in this circumstance. In everyday life, you're not trying to move your hip way out to the side when you're walking. You're just trying to prevent it from excessively internally rotating. So it's just a tiny little lift, activating your glute muscles. And then again, this is to find the muscles. So it helps to hold that end range position. Hold the top position for about 10 seconds rather than just mindlessly moving back and forth like that. Lift up, squeeze and hold. Really try to get a strong, deep contraction there. Hold about 10 seconds and then go back down. Lift up again, hold for 10 seconds, and then go back down. That means you may not need to do as many repetitions as you may be used to doing. Just 5 or 10 repetitions, holding each one for 10 seconds with strict form is going to give you way more benefit than 20, 30, 50, or 100 repetitions where you just go back and forth with bad form. Now, again, this is a low-level exercise. You don't activate your muscles all that much doing this. As a progression, if this gets pretty easy to do, and you can do 10 repetitions holding for 10 seconds, then just slightly separate your heels. Now you're abducting a little bit more. You need to hold this external rotation position. So you don't want to lift your heel up like that, dropping into internal rotation. Your knee always has to stay higher than your heel, and then just a very slight lift. So you're still in external rotation and adding in a little abduction. This means you're now carrying the entire weight of the leg rather than just this portion of the leg when the heels are touching. So again, slight lift of the heel, keeping the knee higher than the heel, and then again, hold for 10 seconds, heels together, knees together. That's one repetition. Now, if you get to where you can do 10 of those holding for 10 seconds, then the next step would be going into that clamshell position, straighten the leg, keeping the toes turned up. If your toes are straight out or downwards, that's neutral or internal rotation of the hip. But again, you want external rotation of the hip and then straight leg out like that. So toes should be turned up. And when the toes are turned up, you don't want to allow your body to roll back with them. So think about rolling your trunk forwards while rolling your leg backwards. So that's the third level clamshell. Now, if you can do that, you're probably ready to move on to more advanced exercises than the clamshell. So here are 3 alternative exercises that are even better than clamshell exercises. We'll start from a low level and move up to a higher level. And you don't necessarily need to be able to get through that entire clamshell progression before starting these exercises. In fact, most of the time these days, I just start people on these standing exercises and skip clamshells altogether. So the first exercise is essentially a clamshell, but standing up. So you'll spread your feet out a little bit, about hips width apart, and then just do the motion of a clamshell, turning your knee out, squeezing your glute, moving your weight a little more onto the outside of your foot. This supinates the foot, externally rotates and slightly abducts the hip, and you're turning the glute muscles on. If you can stand up and bear weight on your leg, this is where I would start. Now you can do this just about anywhere. You can do this standing in line at the grocery store. You can do it standing in the kitchen, cooking dinner. You can do it brushing your teeth. So it's much more accessible and easy to do anytime, anywhere, which means you're likely to do it more often than if you had to get down on the floor to do a clamshell. So again, to review, just do that clamshell movement, putting the weight a little more on the outside of your foot and squeezing your glute while turning the knee out. Now, if you get to where you can do that pretty well, next just start to load a little bit more weight over that leg. So you're going from equal weight on both legs to loading more weight on this stance leg. And that means there's more weight to control, that you have more weight driving you into internal rotation. So that's the second level. And then once you're able to do that, pick up the leg and try to go into single leg stance, keeping your knee turned slightly outwards. Now again, you don't need to be way out like a clamshell down on the floor where you're rolling back. It's more preventing yourself from falling into excessive hip internal rotation. So you don't necessarily need to be externally rotated while doing this. It's just activating the external rotators to prevent you from falling into hip internal rotation. So level 1, turn the foot out. Level 2, shift weight over it. Level 3, single leg stance with complete weight over it. Now the next progression on this is going into a single leg mini squat. This is definitely a more advanced version, and you should master balancing on one leg first, but then start going up and down like that while maintaining the external rotation. You don't want to allow this to happen as you're squatting down. So keep the knee driven out, weight slightly towards the outside of the foot, and then just doing a little mini squat that way. That helps with going up and down stairs and other tasks where you may need to step up with your leg. Now, finally, you want to progress this into a functional activity such as walking. When you're walking, you normally internally rotate your leg a little bit as you're loading weight out on the foot, and then externally rotate as you're pushing off. So the key with loading weight out over the foot is you don't want to allow yourself to internally rotate too much, and you don't want to stay there too long as you're going to push off. So when you're walking, think about hitting slightly more with your weight on the outer side of the foot, squeezing the glute, turning the knee out, very much like that standing clamshell exercise. So it's really just the standing clamshell in motion. So hit on the outside of the foot, squeeze the glute, turn the knee out, step. Hit on the outside of the foot, squeeze the glute, turn the knee out, step. Now you do that in real time, not necessarily slow like I'm showing it. So to see that in real time, it will look just something like this. Doesn't really look like you're exercising, but cognitively you may have to think about doing that for a period of time before it becomes second nature. Research shows on average it takes a little over 2 months to form a new habit, so don't get frustrated if you really have to think about doing it for a while. But the more often you think about doing that motion when you're walking, the quicker it becomes second nature, and the quicker you can do it without thinking about it and also not having hip pain. So hopefully you did find this video helpful to understand why clamshells might not be working for you, how to do them correctly if you want to, and some alternatives that work better. Now, clamshells are just one of many hip pain exercises that people do incorrectly. If you'd like to learn some other exercises that people do wrong, check out this video up here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.